computer. So, okay. Okay, can you all hear?
Yep.
All right, okay, good. Okay. Sharil?
Yes.
Yes. So post the webinar, I'll send you the feedback form because there's another new link that I have to include. So I'll send it to you by either today or tomorrow, or by end of today, I'll send it to you.
Okay.
Okay, thanks, Sharil. So normally what we do is we will wait for a couple of people to come in, like at least 50% of the crowd to be in before we start. As of today,
Registered, Vishana?
42 registered.
Yeah, you know where they're from?
I haven't extracted the information yet.
Because I'm just trying to anticipate the questions.
Oh, okay.
You need anything to do with on the ground MeMoSA you take, okay? Those questions, and I can do the higher level.
Okay.
Let's see. Yeah. If I feel you can answer, I will send the question to you.
Okay.
So what they'll normally do is they'll put the question in the chat or in the Q&A box. So if you can answer the questions, it will be great.
Okay.
Otherwise, after the presentation, I'll ask the questions to both of you all. Or if I can answer, I'll answer it.
Oh, let's see, answer while typing lah.
Yes, under the Q&A box, yeah.
All right, can chat also.
Yeah.
Okay. Let me keep it open.
I need to silence. I need to silence Yana now.
How to say it? Support our scientists. Dinie, you're feeling okay
Yes.
already?
Good.
Good. Your eye, how's the eye?
I think
Looks
it's
healed.
yeah, it looks healed on this side, but it's actually quite a bit here on this side. So,
So
but I
which
already
one was the first eye? So both also kena jangkit lah.
yeah, it happened the right one,
Mm.
and then happened on the left
She
side.
had
Yeah.
conjunctivitis.
Oh, okay.
Your eyesight is okay, right? Not
Yeah,
any
not
problem. Mm. I see people in these pictures who are not even here anymore. Maybe you need to update this page.
Yeah, correct.
Wow,
Yeah,
so they are like even before my time, okay?
oh, okay,
Some
yeah.
of
I mean,
them,
a lot of
yeah.
them are very, very young too.
Yeah, Kui Peng Yang,
I think the comms team may be arranging soon lah for someone to come and take a photo because people come, people leave and all that, right? So
Yeah.
yeah.
But we do have recent photos, right? I think what's that girl who was on your was in the comms team?
Leanne.
Leanne, yes. I think
But
she
then,
has the new shots, yeah.
yeah.
As recent as 2021, I think.
Yep.
2022, yeah. Hey, there are 13 people already. Does that include the three of us, four of us?
It could be, let me check.
Yeah, so no, attendees 9.
Anyway, it's still quite, we only can start 11.
Mm.
Yeah. Good morning, everyone. We are still waiting for people to come in, so just give us a couple of minutes before we start. Thank you. Hi, just give me a minute before I start the presentation today. Okay, I'm going to start. Good morning, everyone. Welcome to our May webinar. So during this webinar, we will be speaking on the Support Our Scientists campaign. So first, let's understand who is Cancer Research Malaysia. So, did you know cancer is racist and it discriminates us? What do I mean by this is some cancers are more common in certain populations and countries compared to the others, mostly because of differences in lifestyle, environment, and genetics. One obvious one that I can think of is that Australians have the highest rate of skin cancers in the world. Did you know for Malaysia, it's oral cancer, which kills more Malaysian and Asian patients compared to people in the Western population? So, what does it mean? Why does it matter? Let me take for example, right? Asians make up 60% of death due to cancer, but in less than 10% in research. More Asians are getting cancer, but in less than 10% of research. When research is done overseas, Asians are not included. What this means is like people like you and me are probably not getting the full benefit of medical discoveries and technological advancement from research as compared to people in the Western population. Why is this important? Why is this important for Asians to be included in research? So let's take for example, imagine walking into a makeup store and not being able to get a makeup that suits your skin tone because they're all made for Western skin tone and not for us. Are you able to wear this makeup that does not match your skin tone and look beautiful or glamorous like how you would want to be? Similarly, you may think for years people in the Western population and us use the same medication and it works fine. But science has shown our genetics are different. Our height, skin color can be different due to our genetics. Therefore, it is important for us to be included in research so that the medications they discover works best for us as well. Cancer Research Malaysia, we are an independent and non-profit cancer research organization based in Malaysia, funded entirely by donation grants. At Cancer Research Malaysia, we are doing research on Asian cancers, and our priority is that Asians are not left out in the fight against cancer. So, today's webinar will be on the Support Our Scientists campaign, and we will be speaking to Dr. Senthilmani Rajendran, or better known as Dr. Sindhu, and Dinie, and we'll be understanding about their work and what got them interested in research and joining Cancer Research Malaysia. Good morning, Dr. Sindhu and Dinie. So Dr. Sindhu also goes as Senthilmani Rajendran, but the both of them are from the digital health team. Welcome to the SOS campaign webinar series. Good morning.
Hi, good morning, Vishala. Thank you for having me.
Okay, so without further ado, we're going to start the webinar for today. Okay, so Dr. Sindhu, this question is actually for you. Why did you choose to join Cancer Research Malaysia? You have the title doctor in front of your name. So I believe that you're actually a dentist by profession. And what made you follow an unconventional pathway and to do a PhD? I mean, you could have just sat in your office, your dental office, and see patients day to day. So what made you join Cancer Research Malaysia?
Thank you, Vishala, for that question. I see you've started with the most difficult question. So I think my decision to change career paths was probably unique at that time and was also a very personal decision. When I was practicing as a dentist, I felt like I could do a little bit more than just treat patients on a one-to-one basis, and I was looking for different opportunities to do that. And at the same time, I was reading up. Digital health was a little bit of a new term being coined at that time. I was reading about it, and I was quite curious how technology can help or improve support healthcare. And that just then I made a decision to pursue a master's degree in health informatics in the UK. And during my degree is when I actually had a lot of exposure to research. My entire degree was research-based, and that's when I actually liked and enjoyed the whole research process and decided that I wanted to transition into research. And I think I was lucky enough when I got back to Malaysia, I stumbled upon this job opportunity from Cancer Research Malaysia. And I interviewed and I got the job, and I think it was a very good fit because I could use both my clinical experience as well as my research experience to help improve the delivery of early detection of oral cancer in Malaysia.
So you're actually currently working on your PhD, am I correct?
Yes, I'm currently pursuing my PhD. I'm in my second year, and I think doing a PhD wasn't part of the plan, but it was a wonderful opportunity that came along during my time in Cancer Research Malaysia. So I was just given an opportunity by our company as well as the Ong Hin Tian and Ong Sim Pek Foundation to work towards a PhD while working on one of our projects.
Okay. So you will have like a double doctorate, Doctor Doctor, or is it Dr. Senthilmani Rajendran, PhD? Is that how you go?
Yeah, I think would be the latter.
Oh, wow. Okay. Dinie, what about you? Could you explain to us or share with us why did you choose to work in Cancer Research Malaysia? A bit about your background too.
I see. So, like for me, I wouldn't say, I don't know if that could also be considered as a unique way how Dr. Sindhu is, but for me, I think I've always been interested in research work, but my uniqueness, I think, in terms that my background was a bit different than what I am currently working right now. My background is mainly in social science, anthropology and sociology, and I did my master's in criminology and forensic psychology. Yes, and then when after I came back after I finished my master's, I just realized that I cannot actually find any research-based work for criminology and forensic psychology here. And I think at that point I was a bit desperate, so that's how I kind of like stumbled upon Cancer Research Malaysia. And that's how I got the job, and I realized that I can actually put my anthropology work and social science work in the current in the digital health team. And actually now I'm currently advocating to everyone that you can actually take social science, especially anthropology, and actually have work out there for you. Yeah.
Could you maybe just explain like a one-liner? How does your work fit into the team, like especially your anthropology background, maybe?
Okay, one liner, I would say anthropology is a study of people and culture. So in everywhere
Okay.
you go, people and culture exist. So
Correct,
yeah,
correct. Yeah. I mean, we do see it in different ways. So, even like marketing and many places like buying trends,
yeah,
people and culture is very much influenced as well. So now, I mean, like you said, there is always a job for social sciences.
yes, yeah.
Yeah. So, this would be my question to you, Dinie. Could you briefly explain the function of the digital health team at Cancer Research Malaysia?
Okay, so for the digital health team, we are among the 9 research unit in Cancer Research Malaysia, where I would say mainly the team focus on developing a telemedicine tool or a digital health tool um, to amplify screening. And currently in digital health team, we came up with a oral cancer screening tool named MeMoSA, where our inspiration basically stemmed from to make oral cancer screening accessible to everyone. Yeah. So currently, we have now developed. Now MeMoSA has been tested in 6 villages in Sarawak, where we appoint healthcare volunteers among the villages in the 6 villages in Sarawak, where they help to capture images of the mouth, and all these images will be sent to the dentist to be reviewed, and or maybe not just the dentist, probably also the specialist also. And this actually kind of like cut off the time for many villages have to travel to the clinic, which probably take a lot of their time and also the cost. And MeMoSA is there in the village to help them. Yeah.
Yeah, I mean, I guess it also, I mean, I strongly believe it also reduces the burden of the healthcare system, right? I mean, it's one thing, it works both ways. It helps the healthcare system. At the same time, it helps people in the remote areas as well, because for them to come out and seek treatment, they don't have the kind of transportations that
Yes.
we have here in Klang Valley.
Yeah.
So they have to like take the sampan and take the boat to come out.
Yes, correct.
And yeah, and for the healthcare system, now that everything is coming on the phone, it reduces their time. That means they can be more focused in the work they do as well.
Yes, correct. Yeah.
Yeah. Dr. Sindhu, is there anything you would like to add on to this question?
Yeah, I think very briefly, I think our team within the work that Dinie has mentioned, it's not just the team within Cancer Research Malaysia, it's also our external collaborators. So we collaborate with the Ministry of Health very closely to ensure that MeMoSA fits into their clinical pathways. And, at the end of the day, we need dentists and specialists from the ministry to be able to review them. So that's why we have to work very closely with them to ensure the success of this program. We also develop AI algorithms to ensure that to ensure that we are able to detect oral lesions without having dentists and specialists sitting on MeMoSA for hours. And that work is in collaboration with the University of Malaya, with our computer scientists who have background in artificial intelligence development. So I think moving forward, we would definitely work very closely with not just these two stakeholders, but also like cancer advocacy groups to ensure that, you know, the program reaches the right communities.
Interesting how you first started off with the telemedicine app, and then now you're integrating it with AI, so that now the AI will start doing the work to see if the lesions are cancerous or not. Am I correct?
Yeah, that's right. And the main aim is to try and relieve workload of our dentists and specialists.
Correct. I mean, AI is now helping our lives in many ways. I mean, you can ask ChatGPT any questions. They also have AI to help you write your resume and everything. So, you know, just making use of what technology is here for, right? Dr. Sindhu, I would like to ask, what is the story behind MeMoSA? Why did it start? And why in Sarawak? Because you said you went to, Dinie mentioned, you know, they went to 6 remote villages in Sarawak. Why did the work start in Sarawak?
Yeah, I think MeMoSA is really the vision of our head of department, Prof. Cheong Sok Ching. So I think back in 2015, she had gone to a rural area in Marudi, Sarawak to collect some samples for her lab studies. So she's a molecular scientist. And at that time, her work mainly revolved around developing treatments for oral cancer patients. And during that trip, it dawned on her with all these geographical challenges that communities in rural areas were not getting access to screening or early detection services. And that means, as she was thinking, there will be no patients to receive the treatments that she's developing in the lab if we do not improve our early detection services. But there was an opportunity. She noticed that there were many telecommunications towers in that area. And that's how the idea of MeMoSA came about, to use telecommunication technology to improve access to oral cancer screening.
Wow, that's a very interesting story. I mean, like, she went in, Prof. Cheong actually went in to collect samples for her work, but then she observed the challenges that the community is going through. And then she just put one and one together. And today, MeMoSA is here. What started off as an idea, today it's being implemented in these villages. That's really a very interesting story. Yeah, it's like a milestone.
It is, yeah.
It is. So, Dr. Sindhu, how has MeMoSA evolved over the years?
Since its inception, MeMoSA has undergone multiple testing. So testing is an integral part of research. You have to ensure that the product you're developing is reliable, safe, and effective. So for MeMoSA, we actually did 3 full clinical trials to test its diagnostic accuracies, and also to understand important factors that can affect its accuracy and how people use it. So this means, like, over the years, MeMoSA was only used under a research setting in selected hospitals in the Klang Valley. But and throughout these trials as well, we have revised and improved MeMoSA to what it is today. As of last year, actually, we were able to finally implement MeMoSA in a Ministry of Health setting in the villages that Dinie has mentioned earlier, the 6 villages. And so currently we have integrated or tried testing the clinical pathway more than the tool itself. So we are testing if MeMoSA will be used by these appointed volunteers, and if are people open to being screened this way using digital health. And so, yeah, that's really a huge milestone for the team to integrate into the clinical services, and we are working towards implementing MeMoSA nationwide.
I mean, it's interesting what, you know, as you mentioned, Prof. Cheong went into the villages, she observed, she came up with the idea, and then it went through research, proper clinical trials. And then now it's, you know, the community is getting the benefits. Very nice to see the transition that actually happened throughout the years when it came to MeMoSA.
Yeah, I think it's very satisfying to see how it evolved from research to implementation. It's wonderful.
Correct. The progress is very nice. Dinie, what are your plans? What is your hopes and dreams for MeMoSA in the coming 5 years?
Yes, in the coming 5 years, well, we really hope that MeMoSA is able to be expanded to many more not just villagers, but to every people that actually deserves this to actually deserves MeMoSA. And and actually, like in the throughout Malaysia, we have a lot of actually more villages that they need the app, the tool, more that when they not just cannot go to the clinic, but actually accessing the phones is also hard. So we are actually hoping that in 5 years time, 5 years time, MeMoSA is able to be probably with a lot undergo with a lot of development, and based on the 6 villages that we have, that we can create an easy tool for everyone to use.
Dr. Sindhu, is there anything you would like to add?
Yeah, I think I echo what Dinie said. Expanding MeMoSA is definitely a priority for us, so that we can impact more lives positively. And we know, as Dinie mentioned, we know many Malaysians outside urban areas face challenges in getting to healthcare centers, either due to personal commitments or geographical barriers. And that's why I think MeMoSA should be provided to everyone for equitable access to screening services. And I think the launch with Ministry of Health in February last year, maybe you can change the slide, sorry. Yeah, so the launch in February with Ministry of Health, just this February, I think it's just the start of this wonderful expansion work in collaboration with the Ministry of Health.
Very interesting. So what are your plans for the funds received through Support Our Scientists campaign? Dinie, you want to go first?
Yes, the funds from that we will be receiving from the Support Our Scientists campaign will not just play a crucial role in expanding and enhancing the impact of the MeMoSA app, but it could also directly contribute to the growth of this initiative by allowing us to reach more communities, to train more healthcare volunteers, and actually improve the overall experience of the app.
Dr. Sindhu, is there anything you would like to add on to this?
Just adding on to what Dinie has said, besides the scale up and clinical integration, we would also like to move our AI work into implementation as well. So that involves regulatory approval and compliance, not just in Malaysia and outside Malaysia as well. And that's where the funds will be very helpful. Other than that, I think it's to raise public awareness and education on oral cancer in general, as well as digital health. We know that oral cancer or any lesions that have potential of becoming cancer are usually painless. People do not come to the clinic until it's at stage 3 or 4. And that's why I think raising awareness is equally important as, getting people screened. So that's where I think we'll use the funds for, yeah.
Correct. People may just think it's an ulcer, but it could be something else that is worse than that,
That's right.
So
yes.
Yeah, so the awareness part is equally important. So my question to the both of you all, why is it important for Malaysians to support research work done by scientists in Malaysia? How does this benefit them? Dr. Sindhu, you want to go first?
Sure. I think it's important to support Malaysians doing research work here, because I think only Malaysians understand local challenges well. I think they are well positioned to address any issues and challenges within our country, including we understand social norms, we understand the healthcare gaps. And I think as a donor, you will be part of a bigger mission in saving lives in Malaysia through cancer research.
Dinie, the same question to you.
Okay, I think it's very important to support local scientists, because it's actually local scientists can contribute to the preservation of our local culture, our local heritage, and overall ecosystem. And them being a local scientist is actually an additional point to the work that they are doing, because it can help them in tailoring to local needs, and also helps to build like a strong infrastructure, like scientific infrastructure for the future generations also. Yeah.
So ultimately, the work that the scientists do at Cancer Research Malaysia will benefit Malaysians or Asians.
Yes.
And Asians.
Yeah.
So it's actually saving Asian lives.
Yeah,
By
correct.
Malaysians for Malaysians.
Yes, correct.
Okay, so we're going to have a quick rapid fire round. So what basically means is I'm going to ask you both one question, and whoever who answers it first is like considered the winner. Okay? Okay. So, are you ready to start?
Yes.
Okay. Name 3 things that the scientists do in the lab.
Conduct experiments, analyze data, record observations.
Okay. Digital health is considered a dry lab or is it a wet lab?
Dry lab.
Dry lab.
Yeah.
Which year was Cancer Research Malaysia established?
2001.
2001. Okay. How many teams are there? How many research teams are there in Cancer Research Malaysia?
9 research. Yeah.
Could you guys name? Could one of you all name 3 of the research group?
Okay.
Core lab, genetic
Mhm.
counseling, community outreach.
Okay, cool.
Okay.
Yeah. So thank you, Dinie and Dr. Sindhu. It was great hearing from you all regarding MeMoSA, how it started off with an idea. And today, it's gone through research, it's gone through clinical trials, and it's being implemented in close to 6 villages in Sarawak. The future plan is to integrate it with AI so that the AI now will start telling that, if that lesion is cancerous or not, so that this, reduces the burden of the healthcare system. At the same time, people in remote areas get access to information about their health as soon as possible. And, they don't wait for it, to come out and seek treatment at a late stage. As we all know, when treatment is given earlier, it works better as well. So
Yes,
I
that's
would
right,
like
Vishana. Thank you.
Thank you. So I'd like to wish the both of you all the best, and hopefully someday MeMoSA will be an app all Malaysians can use too. Okay?
That's our hope too. Thank you.
Thank you, Dinie and Dr.
Thank you for
Sindhu.
having us.
Thank you.
Okay, so what is SOS? It means Support Our Scientists. This webinar is in conjunction of Support Our Scientists campaign featuring the digital health team. So how can you support? You can make donations. Donations are starting as low from 1 ringgit to 1,000 ringgit, or even more if you want, every month, or any amount of one-time contribution to support Cancer Research Malaysia's mission to advance cancer research, develop innovative treatment, and ultimately save lives. So what is the objective of SOS? Number 1 is to raise awareness, to increase public awareness about the importance of cancer research and the impact it has on improving patient outcomes and saving lives. Number 2 is for fundraising, to secure donations from individuals to support cancer research initiative conducted by the Digital Health Research Unit at Cancer Research Malaysia. Number 3 is to advance research, provide financial support to advance groundbreaking strategies for early cancer detection and develop innovative treatments such as MeMoSA, mobile application for mouth cancer detection. Number 4, to foster inclusivity, encourage participation from individuals of all backgrounds by offering flexible donation options starting from low as RM1 ringgit to whichever amount you want, to ensure that everyone can contribute to the fight against cancer regardless of their financial capacity. So if you would like to support us, please take a scan of this QR code here. It will take you to our Give Asia platform where you can make a donation. So if you take a scan of the QR code, it actually takes you to this page where you can make a donation. I am going to skip back a slide so you can take a scan of the QR code. I'll wait here for a minute before I change the slide. Okay, so before I end my webinar today, I'm going to open up the floor for a 5 minutes Q&A. At the same time, we would like to know how the webinar today went. Did you like the topic? Is there any other topic that you would like to hear from us? I would truly appreciate if you could give me a feedback. Please take a scan of the QR code here, and I would love to hear from you. I'm opening up the floor for a 5 minutes Q&A. Dr. Sindhu and Dinie from the digital health team are here with us today, joining us here. So if you have any questions, they will be happy to take them too. Thank you. So there are no questions so far. We'll just wait for 5 minutes anyway. Okay, I don't think there's any questions. We've waited a couple of minutes. I'll just give it 1 minute before closing off the session. Anybody, you have any questions? Okay. So I don't think there's any question. I believe the webinar has answered all your questions. Okay, thank you everyone. Thank you for joining the webinar today. Thank you, Dr. Sindhu and Dinie, for the very informational webinar. I think it's gone a great length to share all the work digital health is doing here at Cancer Research Malaysia. I wish you all the best and thank you everyone for joining us today.
Thank you, Vishala. Thank
Thank
you,
you.
everyone, for
Bye-bye.
joining.
Thank you, everyone.